hearings, and we begin with the ADAM board with our director, David Royer. If you would like to introduce whoever you have. There's Commissioner O'Grady. We were just gonna get started.
Don't hold up already.
No, I just suggested that David introduce his staff.
Good afternoon, and thank you for having us. I'm here with Jonathan Wiley, our Chief Financial Officer, Mark Lambert, Tracy McConkey, as well as Amy Shadwick from our communications area. Obviously, first and foremost, let me thank you for everything you do for us and the support that you offer us on an ongoing basis, especially given the current environment with many of the problems we face both in the mental health community as well as in the area of substance use disorders and in particular the opiate epidemic. I'd like to focus our comments today around a couple of core areas that we think are important to communicate to you about. One is in the area of capital investment. We continue to focus on housing as a strategic priority as there remains a need in the community for additional housing options for people with mental health and or substance use disorders. In particular, we just recently, I think it was last month or two, provided funding for the House of Hope to offer 2 new recovery residents, which will provide housing options for people who want to live in an abstinence-based, sobriety-focused living environment. They currently own and operate 4 recovery residents that are home to 36 people recovering from addiction. Currently, all the houses are at full capacity, and there's a wait list to get in. These 2 new additional houses will expand their capacity to serve an additional 10 adult men. I also want to thank the Ohio Department of Mental Health and Addiction Services as they also provided state capital funds to finance these recovery houses. And next week we actually are taking another board action to the board for what we call level 3 recovery house, which is going to house 10 individuals who are in need of active treatment support, and so we will be funding, I think the action calls for us to help finance $357,000 to continue more intensive supports for people that are in the early stage of recovery. Within the mental health arena, in 2018 we expect the Laurel Green project to open. It's a 40-unit, 1-bedroom apartment, including a unit for a resident manager. It's a 3-story structure. It's located off of 161 inside of 71. The project will provide housing to Franklin County residents who've been diagnosed with severe and persistent mental illnesses and duly diagnosed individuals who do not meet the housing and urban development definition of homelessness upon admission. The capital cost of this project to build this apartment building was $6.7 million. And was made possible by many generous funders, including ADAM Board, the Ohio Department of Mental Health, as well as private equity tax credit funding. One of the emerging areas that we're really starting to focus on, in addition to the continuing need of capital investment, is within the concept of technology and how technology starts to interface with the recipient of service, whether they're recovering from a mental illness or a substance use disorder. In today's landscape, more and more consumers are demanding mobile and technology-based solutions, and this trend is not any different for us in the behavioral health care arena. One of the things that we have entered into with the support of the Columbus Foundation and their Critical Need Alert was an Ascent. It's called the Ascent Addiction Recovery Solution. It's an app and a peer recovery coach. The app gives people the ability to engage with other app users, find available resources close by, and keep track of the medical appointments and medications. It also gives, and this is really important, it gives clients access to help 24 hours a day, 7 days a week, 365 days a year with just the touch of the app. If a person reaches out for help, they'll be connected with a certified peer recovery specialist, and these specialists are people who are actively in recovery themselves and are able to provide the person with support and resources. I believe we're working with the Ohio State University Department of Social Work for the evaluation of this app. And we are involved with not only people that are in the treatment centers that we do business with, but also we're targeting some folks from the specialized dockets here at the courthouse to give them that peer support process as they go through the drug court programs. The other thing that we've done is we've expanded NetCare's ability to have crisis line and chat. These clinicians are available 24 hours a day, 7 days a week, 365 days a year to assist callers who are in crisis or are looking for the most appropriate resources and the information for a family member or friend. They handle over 96,000 calls in 2017 alone. This year we expanded these services by adding a new live crisis chat for those who may be in crisis. A trained crisis counselor at NetCare will chat with the consumer about what they're going through and listen and to see how they're feeling. I think we're all familiar now, almost every website that we interact with, there's a chat opportunity to chat directly via the internet, and now we have that ability with our clinicians so that people that maybe don't want to pick up the phone can actually, with a trained certified counselor, actually reach out and have a chat with them about some of their specialized needs. We're populating that chat button so that if you go on to ADAMH's website or Centero's, Concord Counseling, and you want to interact with a trained crisis counselor 24/7, you can do that through that chat feature. Within the area of suicide prevention and hotline, North Central Mental Health Center provides our suicide prevention services. The suicide prevention efforts include 3 hotlines, the suicide line, teen hotline, and senior hotline. They are available 24, 7 days a week and are staffed by volunteers. In 2015, the suicide hotline received over 9,300 calls. North Central is also now providing a suicide prevention text line. This text line is monitored Monday through Friday from 12 p.m. to 10 p.m. with the hope of increased hours in the future. Through our work on developing the Opiate Action Plan, a theme emerged, the need for quicker access to treatment next year, and actually we launched this early, I think it was December 6th. We piloted a program that will incentivize providers to deliver service on the same day they receive the referral. One of the things that we heard throughout the Opiate Action Planning process from first responders, including emergency room physicians, was the need for more immediate access to care. We believe that using technology now, we can get a referral out to our drug treatment community and we offer them a payment incentive to take that person within 1 business day. The reason that is important is that we know that if we can engage the person at the moment when they require it or want the help, there's a greater probability we can sustain them for a longer period of time. The longer you're engaged in that treatment process, the higher the probability of a positive outcome. We're excited about this incentive program, and I look forward to coming back to report to you on the progress of that. Another theme this year is that we've really worked hard on is this idea of public and private partnerships. Partnership and collaboration is really the Franklin County or Columbus way, and we've tried to weave that throughout many of the things that we do. In the area of mobile response, Southeast Inc. is expanding its opiate crisis response services to the 3 major hospital systems: Ohio Health, Mount Carmel, and OSU Wexner Medical Center. These expanded services allow emergency departments to make direct referrals to the Southeast Mobile Opiate Response Team in cases where the individual has overdosed is in need of treatment. The goal of this program is to assist emergency room staff, nurses, social workers, and peer advocates with immediate linkage for treatment for patients who have overdosed in the community. This integrated model hopes to improve patients' immediate access to addiction and other health services while reducing the number of people who leave against medical advice. Southeast has developed a collaborative model to improve the access and quality for those individuals who experience an opiate overdose by providing rapid engagement and access to care. This team responds to direct referrals from the emergency departments throughout Franklin County, and the team will provide outreach after an opiate overdose for continued engagement. the Addiction Stabilization Center, and I want to thank Commissioner O'Grady representing the commissioners. I think it was last week. We held the ribbon cutting for the opening of the Stabilization Center, and this is a new 55-bed center that is designed to meet the demand of the growing epidemic. Within the city of Columbus, an average of 10 to 15 people per day receive naloxone, the overdose reversal drug. In an effort to provide immediate stabilization, engagement, and access to care, this stabilization center will provide 24/7 access location for EMS and police to transport a person who is overdosed. The goal of this center is to break the cycle for some people who have repeatedly overdosed and are revived with naloxone. The new center that will open hopefully this week or next week was made possible because of the support of many partners, including Mary Haven, the City of Columbus, the Osteopathic Heritage Foundation, the Columbus Foundation, the Ingram White Castle Foundation, as well as your support. We also are in the process of working with our private sector, our corporate sector, and developing a community education strategy about how to best prevent people becoming addicted to opiates in the first place. We look forward to announcing something here in the spring with our corporate partners that we hope will be able to touch every sector of our economy. Within the area of Vivitrol, I think as you know, through CURES funding, we've also increased our investment to provide Vivitrol injections to 520 people prior to the release from the county jail. We'll also cover the necessary medical evaluation and oversight needed to administer these injections. We know, of course, that the FDA found that 90% of the subjects who received Vivitrol remained abstinent over the course of the study and remained in treatment longer. This compared to only 36% of those that received a placebo. We've also worked with the Franklin County Sheriff's Office, the Department of the Criminal Justice Services Department here at the county to work with NAFCARE to create a program that will conduct the appropriate medical evaluation, oversight, and purchase in the form of Vivitrol. I also just want to point out that we've been able to do some of these things, whether it's Project React, whether it's been the Stabilization Center, as well as some of the with the Vivitrol at the jail through $1.9 million funding through the Federal Cures Act. This money has been appropriated by the federal government for this year. We're optimistic that they'll reappropriate it next year, but it's important to note, I think, that when it comes to either state or federal funding, it's a year-by-year proposition. We continue to work within our community on a couple of other initiatives. One that we're working with is one of the things we heard through the opiate planning process. In talking to folks of color in our community, it was that we needed to understand that how to reach out to those that are maybe addicted to opiate will take a different type of effort. And so we funded community navigators, if you will, or community outreach specialists with Community for New Directions, who will work in a much more of a reach out effort to try to engage people in that conversation about treatment and recovery. As well as this next week, we'll be carrying another action for our refugee and New American community for community outreach specialists as well. One of the things that has become a concern to us is that the rate of suicide with the Burmese Nepalese community seems to have been on the rise, and we've been working with North Community Mental Health Center and putting together a proposal to begin to try to reach out to that community, we think, in a much more collaborative manner. So those are some of the things that we're attempting to address that we've been working on this year, as well as obviously going into next year. Let me close by again thanking you for everything that you do for us in order to serve the citizens of this county.
David, as you open the stabilization center, do you anticipate having more capacity at NetCare for those with mental health issues so that officers can take people to NetCare and have them be stabilized there instead of be arrested?
One of the problems that we have faced is the limited capacity of Netcare. As you know, that all too often Netcare is on divert. And we're hopeful that one of the things we did to try to address the adult population, I think maybe we talked about last year, is we were able to move our children's crisis services, psychiatric and mental health crisis services, to Nationwide Children. So we consolidated those crisis services at Nationwide Children. As it relates to Netcare, we're hopeful that the stabilization center will help in some way. I don't want to mislead you, though, that I do think that capacity is a problem. We actually took our board out to visit Netcare, and we asked them directly, how much more capacity do you think you need? And they estimated 25, I think it was 25 to 35 additional beds. With the movement towards managed care, and a lot of the population that populates, about half of it, is going to be under managed care. It's not clear. We've been able to negotiate 2 contracts with 2 of the 5 managed care companies to pay a per diem rate for those crisis services. However, not all the managed care companies are on board yet. A lot of the financing for that kind of intensive level will have to come from the support from the managed care, Medicaid managed care plans. But there's no doubt that there's an underbedding there. Will the stabilization help? Some, but I don't, it will not be the solution to some of the diverts that we're experiencing.
So we're still gonna have to work on
Yeah.
trying to get them off
Yes,
diversion.
absolutely,
Yeah.
absolutely.
So, David, the stabilization center is awesome. Thank you for all the hard work that you guys have put into to make that a reality. You know, I just have nothing but fantastic things to say. You know, ever since we contacted you and reached out and said, you know, we need a community response to this problem, you and your team have done a fantastic job to bring people together and put together a great team to begin to address, well, not begin to address, you guys were addressing the problem before, but to begin to bring everybody to the table. You know, our conversations that we were having here with Dr. Long and you know, with City Council President Zach Klein and the mayor, you know, we just wanted to do what we could to put all the right people around the table, because we needed to have a community-wide response to this thing. And, you know, we just had thoughts, we had ideas, we had, you know, we were talking to our colleagues around the state, trying to get a sense of what everybody was doing. And, you know, I had a couple conversations with you, and you made it happen. And you guys, you know, you guys are unbelievable professionals, and you know, I mean, this is a big, scary problem. And, you know, as public officials, this thing, you know, is a huge issue, and it's something that, you know, I mean, it's a big deal, it's a big issue, and it's something that scares us to death. And you guys just stepped up and said, you know, we'll take care of it, we'll deal with it, you know, and you guys just have, and you guys have been great to work with. The people that you guys work with, the professionals in your organization, the professionals that you guys deal with in your network, it's just great to be around people like you guys. And so I really appreciate, as public officials, and I guarantee I can speak for the mayor and for Zach and for my colleagues and everybody else, it's just great to be around professionals like you guys, because we're just folks that are, you know, elected to try to do this stuff, and you guys are professionals every day, and stuff you do and the people that you guys work with. So it's great that, you know, we can turn to you guys, and you guys can take this ball and run with it the way you have.
Thank you. We appreciate that, and we appreciate your kind comments. I can tell you that we have a group of motivated professionals at our office that believe in our mission. We try to work to the mission every day. Some days we have better days than others, but I will continue to promise you that we will do everything we can. There's actually a Showtime piece that's going to be coming out about this issue of opiate addiction. And when you watch this, the pain that families feel from this horrible epidemic, it's easy to be motivated to try to somehow make somebody's life better one day at a time. So thank you very much.
Well, I mean, what we do every day is government work. What we do every day is run county government, and it's a broad section of public policy, and it's what we're good at. What we aren't good at is dealing with the type of things that you guys deal with every day, and we got hit with this, and so it was very relieving to be able to turn to you guys, knowing that this is something that you could handle, and you did, and boy, I'll tell you.
Thank you.
I know that I've talked to Zach about it, and it's, so thank you.
You're welcome.
Thank you.
Director, thanks. Good to see you.
you.
For being here.
Good morning.
The most important
That's right.
Franklin County
Absolutely.
Department right here.
I'll tell you right
Again.
now, I've been feeling that way for a couple months, so.
Director, I want to just talk a little bit about how your budget is structured. And I think for the folks listening or watching, or some of us that are new, if you could, you are predominantly levy funded. And so if you could explain that, as well as if and how much general fund subsidy you get or not. If you could just cover that, and then I've got a couple follow-up questions.
Yes, sir. Excuse me, sir. Yes, we are a levy-funded agency. We have a 2.2 mil levy that was most recently passed in 2015. It was a renewal from the 2005 budget. It actually collects less revenue now than it did in 2005 because of the recession. It is the backstop, if you will, for what we're able to offer this community. Our total operating budget is about $80 million. We do not receive any general revenue funds from the county. We do it with state, federal, and local dollars through the levy. We try to present a comprehensive plan to address the needs of people with severe and persistent mental illnesses, as well as people with substance use disorders. The bulk of those funds are used for treatment. However, we do spend a considerable amount of money, I don't remember the exact number, about 10% of our funds on prevention and early intervention. Unfortunately, too much, in my estimation, too much of the money sometimes has to go to these pressing needs. But we are committed to working with our school districts and our community partners, and making sure that we try to reach out as many to many groups as possible about the importance of both prevention, but also health promotion and mental wellness, emotional wellness. One of our initiatives last year, and we continue to fund, is with our school districts. And trying to reach out to make sure that any child who is starting to experience some emotional difficulties, we can offer some professional assistance and professional advice, so that we can engage that child at an early age within the helping community, in the hopes that we can prevent longer-term tragedy. Excuse me.
So let me zero in on the opiate crisis that my colleagues talked about. And I too want to join in saying thank you for taking this on. I mean, not that you haven't been already taking it on, because it's been a fight that's existed for a long time, but the strategy just changed, our approach has changed, so I can appreciate your leadership there. But so of the $80+ million that you just outlined, what percentage of it is dedicated to the crisis? I know there's different pieces that come out, different buckets, so if you're just estimating, would you say it's 10% of the budget is dedicated to opiate crisis, and that's prevention, addiction services, so forth?
Commissioner, we have about a $6 million. We have a $6 million request in the 2018 budget to spend on top of what we're already investing. As far as the Addiction Stabilization Center, it's about an $8 million a year operation. half of which will be funded with ADAM and federal funds. The other half will be paid for through Medicaid, which you don't see it in this budget, but that's part of what's funding that center. So that's what makes the expansion so important. So our budget with, our other budget with crisis services for net care is about $11 million. To your point earlier, it's one of the largest, if not the largest single investment we make. To this point, they have dealt with both addiction and mental health services and will continue to, but now with the Addiction Stabilization Center, we have another resource available to us.
Okay.
And I think prior to some of the expansion that we've undertaken in response to the opiate crisis, we've generally directed, I want to say, in excess of $20 million a year for substance use disorder treatment, largely through agencies such as Comp Drug, Mary Haven, obviously, House of Hope, Amethyst, Alvis House, as well as some of our work that we do with the courts as well.
And Zach, Director, do we, I can't recall, in our community partnership funds, we give to some of those agencies that he just outlined, if I could remember correctly. I know that's an on-the-spot question, but and the point I'm trying to make is that I'm trying to show all of the funds that are dedicated towards opiate crisis, and or doing. I know some of the agencies that we do through community partnerships,
That's right.
you know, are part of that
Right.
spectrum of agencies that serve that topic area.
And I think the one in particular, I think Nationwide Children's Hospital, some of the investments in recent years with their suicide prevention efforts as well.
Correct.
Not
Yeah.
only that, but in the state capital budget request that we just received, there's request dollars in there for, and Eric can speak to this, but for Mary Haven, for Alvis House, and for others. So we have the opportunity to advocate from the county's perspective for those things as well, for opiate assistance dollars.
And mental health and opiate also often goes together. We've had,
You haven't seen it,
just
you have a big
recently,
sheet
I
on
had
your desk.
a couple of women who just got out of the jail, having had their first Vivitrol shot, having gone through programming through the Pathways program. They are in the programs that you fund for mental health counseling for their Vivitrol shots monthly. They're feeling bright, they're feeling optimistic, they're feeling hopeful for the first time. And these are women that have been in jail, out of jail, in jail, out of jail many times. The first time they are feeling hopeful. And it's because of both the programming they had in the jail as well as the Vivitrol shots they're getting. They're feeling better, they're feeling healthier, they know there's hope out there. And thank you.
Thank you. Yeah, I think to your point, one of the things that while we appreciate the attention that you've showered us with a little bit today, I think it's important to understand that this really is a true collaborative effort, and that there are funding sources that come in from all directions. I mean, I think about your community partnership. You've had a longstanding community partnership with the Shelter Board. I know with Mary Haven and many of the nonprofits, and all too often, unfortunately, many of these folks that you're helping to support, these agencies, experience some of the problems that we also support. So I really want to acknowledge and thank so many of our community partners, especially what you do here at the County Commission.
Yeah, and I appreciate that. I mean, what I was trying to really illustrate is in this conversation, I'm sure you've paid attention to around extending the current sales tax rate permanently, and embedded in that is funding to programs like our community partnerships. And so I was really trying to illustrate the connection to this opiate crisis work that you're doing, that general funds do go towards, and how if we choose not to extend that sales tax rate, many of those programs will likely take a cut over the next couple of years, to the point of probably elimination. And that sort of takes us in a step backwards, and that's what I was really trying to
Yeah, and
illustrate.
I think your point, we're making traction, and we're gonna make progress, and we're gonna save people's lives, and we're gonna help families recover. But we can't go backwards. We have to have all the resources, that, we can bring that are available to muster towards this issue, as well as other issues that the community faces, if we're gonna continue to be a healthful, vibrant, prosperous county. And I thank you for your courage in that issue.
Yeah, sure.
Thank you.
Thanks, David. Thanks, appreciate it. Thanks for your time today, Jonathan, thank you.
Thank you.
Thank you.
Appreciate it. Thanks. Well, we only went 10 minutes over that time. That